The following arthroscopic video is a case of a 12-year-old male with an unstable OCD lesion of the lateral aspect of the medial-femoral condyle. Here we can see an arthroscopic image of a probe in the anteromedial portal evaluating the lesion for stability. There's clear ballotability and mobility of the lesion at various sites and throughout the lesion, suggestive of instability. When we look at the medial margin of the lesion, one can also see slight step-off or irregularity in the contour. We're moving towards fixation of the lesion with bioabsorbable tacks. Here you can see a metal cannula and then a small bioabsorbable tack with small barbs or ribs on the shaft of the implant and a head being pushed in with a small tamp in the drilled hole made in the cannula. Here you can see the bioabsorbable tack flush with the articular cartilage and now being placed deep to the superficial aspect of the articular cartilage, and instead it's being tamped to the level of the subchondral bone. This will impact the mobile lesion and make it immobile, as well as keep the implant below the level of any articulation with the tibial cartilage. As the lesion is of moderate size, 3 different bioabsorbable tacks are being placed. Here's a second location of tack placement through a metal cannula in similar fashion. Drilling was performed perpendicular to the lesion, and then the tack was placed, keeping the cannula in place over the drilled hole. The tack was impacted into place. This is anterior to the previous tack, and again the tack is impacted below the level of the articular cartilage to ensure no articulation with the tibial cartilage, maximum compression, and bioabsorbability deep to the joint surface. These tacks have the advantage of being MRI compatible without creating artifacts, so assessment of the subchondral bone healing can be made. Here you can see the 2 tacks placed. A third tack is placed posterior to the 2 previous tacks, but here is a small 0.045 C-wire or K-wire being used to perform drilling around the placement of the tacks. Drilling can be performed prior to or after tack fixation, but if the fixation implants are placed prior to drilling, care must be taken to ensure that the drilling does not affect the integrity of the fixation implants. The knee is taken through various degrees of flexion and extension to be able to ensure a perpendicular entry point of the C-wire or K-wire. The C-wire or K-wire is advanced between 1.5 and 2.5 millimeters into the subchondral bone, generally through the area of unhealthy subchondral bone up into the healthy cancellous bone. Here you can see the lesion after 3-tack fixation and drilling performed 15 to 20 times around the tacks, covering all regions of the OCD lesion. This should provide stability